What's a health myth that drives you crazy because you know it's false? Oh man, that eating certain foods or drinks can alkalinize your blood? Your body runs such a tight ship to maintain your blood pH, and you do not want it any different. I had to sit through a health education course, and the instructor recommended us to add some lemon to tap water. That would make it more basic and alkaline, and thus more healthy. I raised my hand and asked, but aren't lemons acidic? How would adding something acidic to water make it more alkaline? The instructor looked at me like I was crazy. Then she said, lemons are fruits. Fruits are alkaline. That's how I knew I shouldn't take everything at that course at face value. According to the obstetrician at the hospital, nursing is 94% effective as a method of birth control. When she told me that, I sarcastically responded, yes, that is why we named our daughter 6%. So it's possible, but improbable. P.S. 94% effective as birth control means that if you take 100 couples who correctly use that form of birth control, there will be 6 pregnancies per year. I'm a doctor, so most of them. The ones that drive me super crazy though are the ones that are actively dangerous. You want to sell cancer patients some supplements with their chemotherapy? Sure, as long as their oncologist and pharmacist know about them and have confirmed no interactions, and the patient has the money to easily afford them. Fine, go nuts. You want to tell people black pepper will cure their easily treatable cancer so they shouldn't do chemo, and then ghost them when they show up with metastatic breast cancer lumps pushing through their skin? You pathological psychopath. There's blood on your hands. And don't even get me started on the anti-vaxxers. They somehow believe all of us are in the pocket of big pharmacy, to the point that we vaccinate our own infants and families? Doctor families have among the highest rates of child vaccination. You. I care about my children more than I care about any money. I vaccinate my kids because I know it can save their lives. You didn't. We had a wellness day at work. Cholesterol screening was elevated. The nurse suggested all the supplements. She knew I was taking Coumadin, a blood thinner. All of them interacted with it. Defibrillators restart hearts. TV shows get that wrong all the damn time. Defibrillator, for when your heart is fibrillating. My mother-in-law's visit is once a year for a few months. She gets irritated when I decline her breakfast, fried plantains, chorizo meat, and fit corn tortillas, and cook 2 eggs and have toast for my breakfast. She swears that my cholesterol is elevated because I eat too many eggs. The thing is that I work many hours in the summer, and she cooks and packs lunch for me. She loves cooking with lots of vegetable oils, to the point that when I open the Tupperware, I can see a layer of fat on the food she prepared. Yet she says eating eggs is my problem. I went to get checked last summer because I was feeling like crap. It turns out my cholesterol and triglycerides were through the roof. The myth that eggs raise cholesterol has been debunked by science. Dermatologist here. The myth that letting a wound air out or dry out helps it heal. The Vaseline slathered moist but clean wounds heal best. Less scar, quicker healing. I shouldn't say it's false so much as it's misleading. Skinny equals healthy and fat equals unhealthy. Obviously, extremely overweight and extremely underweight are objectively unhealthy, but long-term health outcomes for people in the overweight category tend to be better than people in the underweight category. Yet people who are underweight, not talking extremes, tend to be praised for how healthy they are, and overweight people are criticized for their lack of health. Yes! For years I complained to doctors that I couldn't gain weight and had chronic low blood pressure. No one thought it was an issue. I am 5 feet 7 inches and weighed 117 pounds at my lowest, with my norm being around 123. No matter what I did, I couldn't put on weight. Then, out of the blue, 5 years ago, I gained 85 pounds in roughly 8 months without changing a thing. Then the fatigue, joint pain, rashes, and photosensitivity kicked in. I was going to every doctor and specialist imaginable trying to figure out what was going on. Every one of them told me I just needed to lose weight. Then the blood in my urine started, and I was finally diagnosed with lupus. My rheumatologist said the weight struggle was likely an early symptom. That women, yes I am one, don't need to wash their vulva because it's self-cleaning. No. The vagina, meaning the actual vaginal canal, is self-cleaning. All the outside bits are not. All those folds, nooks, and crannies, inner and outer labia, clitoral hood, accumulate sweat, skin cells, blood from menstruation, discharge from the vagina cleaning itself, oils from your sebaceous glands in the area? I've always washed my bits with my hands, warm water, and mild soap. You certainly don't need any fancy washes for the area, and the more chemicals and perfumes, the worse it is for such a sensitive area. And I've never had so much as a yeast infection. But I'm always baffled when I see another woman saying they don't wash their vulva at all or just with plain water. I like being clean, and I like my guy to go down on me. I wouldn't want to give him head if he didn't wash his genitals or just used water to rinse them. Putting butter on a burn. I work in a bakery. We burn ourselves all the time. The amount of time someone has suggested putting butter, oil, or mustard on a burn makes me want to bang their heads against a wall. Cool water, not cold, and not ice. And then use burn treatment. Why would you want to put something that will trap the heat in?